Doctors, who were your dumbest patients? I worked at the ER during my internship and met a girl who had increasingly painful and red eyes since a couple of days back. The last 24H had been horrible. I asked about all the normal stuff, and she claimed to have no idea why she had this eye problem. She had never had anything wrong with her eyes. I proceed to drop some dye in her eyes to check them in a microscope, and when I do, I realize she's wearing contacts. She didn't like her natural eye color, so she had bought a set of blue-colored lenses 8 months earlier. Never removed them, not even during nighttime. Didn't even think to mention this to me. Claimed to have no foreign materials in her eyes. Needless to say, I gave her quite the harsh lecture and a referral to an ophthalmologist. I posted this a while back when a similar question was asked. GP here. The most outrageous thing I've heard was from a boy who was something like 20 to 22 years old. Very poor, illiterate family. The boy had a bad case of tonsillitis and refused to take any meds because all he needed to do was bite the sun. Basically, at noon he had to look up to the sun, open his mouth as wide as possible, and bite the sun several times so it would burn his tonsils and cure him over the course of a couple weeks. When that would work, plan B was to do the same at night, but only under a full moon. TLDR, bite the sun and cure you tonsillitis. Had a patient who was convinced that drinking grape juice with baking soda was helping him fight prostate cancer. But your cancer is actually getting worse. I'm gonna stick with my plan. I really feel like it's helping. Edit. Yes, it is kind of like Steve Jobs. You can all stop replying that now, because we all get it. I was an intern in the ER. I've seen a lot of stupid people. It was a small town and all. The worst I think was when I walked in, and the floors smelled like... I don't even know. It was by far the worst thing I had ever smelled. I asked a passing nurse what the smell was, and he just shrugged his shoulders and told me someone probably shit everywhere. Well, the doctor is preparing to go into this room, but I did not expect what would happen next. He opened the door, and I almost barfed. It was extremely hard to keep my professional composure. The guy had his leg wrapped up. The doctor asked him to unwrap it, and it was gangrene. From his foot up to the middle of his thigh. The smell I had been smelling was rotting flesh. The cause? The four-wheeler I was riding caught fire 6 months ago. Surgical resident here. One that comes to mind while I was on the cardiothoracic service was a gentleman that came in through the trauma bay with a stab wound to the chest. He reported after we fixed a rather large hole in his right ventricle that he was just visiting a friend, and while on the stoop of the building, a random stanger stabbed him with a sword from a first-floor window. He proceeds to laugh, get back in his car with his buddies, and drive home, despite the rather profuse bleeding from his chest. He drives home for some period of time, and then eventually decides he should go to the hospital. Drives by himself to the hospital. Last thing he remembers was being on the way to the hospital. Lucky bastard was found in the parking lot, had passed out in his car. Eventually made it to the OR and walked away just fine. TLDR, jackass gets stabbed in the heart, decides to go home and hang out for a while, eventually somehow drives himself to hospital before dying, and without killing someone else on the road. I'm guessing he panicked and thought, there is no way that just happened. Well, okay, but it's not that bad. Nope, it can't be, not a stab wound from a sword. That's a death for past people. Yeah, I'm on a dope. I once had a 20-year-old and his girlfriend come in at 2 a.m. freaking out because something had tore his throat open. He seemed fine. No blood. Breathing fine. I had him open his mouth, saw nothing. So didn't want him to lose confidence in me. Clearly something had happened, so I'm looking and looking. There is nothing wrong with this kid's throat. Finally I say, look, it seems okay. What do you feel or see? I don't feel it, but look, ITS right there. Where? Looking. It was his uvula. Somehow this kid had gotten to the age of 20 without ever noticing his uvula. Girlfriend was also horrified. I told him it was normal. Did not believe me. So I told him I was about to blow their minds and showed him his girlfriend's uvula. Mind's blown. Another life saved in the ER. I work as a scribe in the ER, and we had a guy come and asking to be tested because he may have an STD. So we start asking him if he has had unprotected sex and multiple partners, to which he answers yes. Next we ask if he has any itching, rash, discharge, etc., to which he answers no. Well, this guy thought he caught asthma from having sex with some chick who had it. Asthma. He thought it was an STD. Optometrist here. Had a guy come in for a glasses exam for the first time in 10 years, and I discovered he had full-blown glaucoma going on, and I asked him if I could run a test to help confirm. He got super angry with me and demanded his prescription. I said I'll give that to you, but I need to prescribe you medicine to help save your sight. His response was, well, if the good Lord wants me to lose my sight, then who am I to stop him? I made him sign a waiver, and he left. I've never been so frustrated at a patient. I hope he doesn't kill someone on the road one day. Had a Marine once who came to me complaining of a rash to his right forearm C2 weeks. This was his first visit for the issue, and hadn't had anything like this before and was worried, since he reported worsening symptoms since initial onset. When asking about prior skin issues, he told me he had ringworm just prior to this rash. Look at his arm. It looked like a mild second-degree chemical burn in a rather circular shape, with blisters on the edges. What got me was the exact definition in the burn edge. Asking the young LCPL how he got that, he replied, "Well, that's the burn I got from the bleach I poured on my arm." When I asking him why he poured bleach on his arm, well, how else was I going to kill the ringworm? Turns out using cement as a DIY cast for your broken, but not reset, leg is a bad idea. Turns out the chemicals in the cement irritate and dissolve your skin. He became septic and almost died by the time he presented for medical care. Emergency medicine, preventing natural selection one stupid person at a time. I had a patient who came to the emergency department vomiting so much I had to admit him for intravenous fluids. I took the usual history, including what he'd eaten recently. Nothing out of the ordinary. A few hours later, he calls me over. "Doctor, I did eat some chicken and rice earlier. My girlfriend made it yesterday, and we left it in the pan on top of the stove overnight, and I ate it this afternoon. This was in a July heat wave. Do you think that could have been it?" Yes, I do. Besides, we had a little talk about food hygiene. As a med student myself, and another student took a history from a guy who drank several, 10+ cups of tea a day with 6 sugars in each one for my thirst, and had 6 meals a day of 4 bacon sandwiches with butter for the energy. That's all he had every day. That's it. He couldn't understand why his heart disease wasn't getting better, why he'd put on weight, why he was now showing high blood sugar and was borderline diabetic. Edit. Seriously, guys, to the people telling me, but bacon isn't bad food, or whatever, I never said it was. Read what I posted, especially the bit where I said that's all he had every day. That's it. Because if you can't process that with the rest of what I've said, I think you're in danger of becoming a patient mentioned in threads like this. When I was doing rounds in the ER for my medic, I encountered this woman. She was in her early 40s and was apparently a frequent flyer for pain meds. Since she had become known in the community, this was a small city in West Michigan. She was no longer able to trick doctors into giving her meds. So what does she do? She pulls out her own teeth. She had tried to do a couple, but they wouldn't come all the way out. She did eventually get one out, bit this was after a few attempts. This isn't the stupid part, however. She felt that this may not do the trick. So she waited for a few days knowing she would get an infection and we would have no choice but to give her what she wanted. Well, it didn't work. They gave her NSAIDs and antibiotics. Took care of a patient who I diagnosed with non-Hodgkin's lymphoma. This sweet woman was in her late 20s. For those that don't know, NHL responds pretty well to chemo. Her father-in-law had a business selling camel's milk. She opted for a camel's milk treatment plan over chemotherapy. She was convinced that camel's milk can treat anything. She said she came to the hospital just to find out what it was that she was going to treat with the camel's milk. She had a 2- and a 4-year-old. Fortunately, I could convince her to only try camel's milk for a finite amount of time and then follow up with our oncologist to see if camel's milk did the trick. Edit. Typos from speech to text. Common situation. Do you take any medications? Just aspirin. Okay, great. Later on, do you have any numbness or tingling in your legs? Yes. From the diabetes. Oh, you're diabetic? Yeah, but I'm taking meds for that. Pensaface, okay, sounds good. Any other medications? No. Okay. Later on, how much are you exercising? Well, I try to walk a couple times per week because of my blood pressure. Oh, you have high blood pressure too? Yes. Are you medicated? Yes. Persevering face, subconsciously thinking, goddamn it. Had a 70-year-old female come in with a broken rib and clavicle after falling. Tells me her only medications are insulin and Tums. While taking her history, she seems off. She's acting confused, her voice is deep, her face is swollen, and she's been having balance problems, textbook hypothyroidism. Turns out she had her thyroid removed a year ago. When I asked her if she was taking any medications for that, she tells me yes, the Tums, I need the calcium for my thyroid. Where she came up with the idea that Tums were a great substitute for your thyroid, I will never know. Needless to say, she left with a new Synthroid RX. I work as a medical assistant in a dermatology clinic, and we had a middle-aged woman come in complaining of vaginal and rectal itchiness. She said she had a boyfriend with whom she regularly had sex, and attributed that to the itching, so I had her disrobe from the waist down and sit on the exam table for the provider to check. It was obvious that she didn't wash or wipe herself down there like ever. The doctor told her that she only had mild irritation to speak of, and that she needed to regularly wash her privates with mild soap and warm water, to which the patient surprisingly asked, "It's safe to do that?" Patient's parents were given the usual pre-op instructions. Blah, blah, blah. Patient needs to be NPO the usual 8 hours prior to surgery. Clear liquids only dash. You can see through it. Parents the next morning during admission said they followed the instructions to the letter. They only gave the patient donuts because they could see through it. Not a doctor, but EMT. I was working in the ER and a homeless guy comes in. Not unusual. He looked completely fine, but he was complaining of unbearable leg pain. My job in the ER basically is to do initial assessment/vitals and to get patients settled in. So I go to check out his legs. I cut through his pants and he's wearing knee-high socks. As soon as I cut through the elastic on the socks, maggots. Like a waterfall of them. Turns out he was wearing the same socks for 6 months and they cut into his skin. Good knees North surgeon said he could save his legs thanks to the maggots. Lesson is change your socks regularly. Gastroenterologist here. 2 similar patients years apart. First one came in with signs and symptoms of cirrhosis. Said he only drank 1 drink per day and insisted on it. And how could he get cirrhosis on 1 drink per day? By the way, women have been reported to get cirrhosis on as little as 2 drinks per day, but it's pretty unlikely. Anyway, his wife comes in later and tells me he bought a large glass that holds 32 ounces of fluid, and that is his 1 drink. Years later, I diagnosed another man with alcoholic cirrhosis, and he, too, was incredulous. How could he get cirrhosis? He didn't drink at all. Just beer. How much? A case per day. Well, that's not really the stupid part. He drank during the day, on his job, as an electric company lineman, working on hot power lines 30 to 50 feet up. He would drive his truck from one site to the next, drinking beer between each site, and by the end of the day, the case of beer would be finished. Amazing he made it long enough to get cirrhosis. Actually, he was one of the nicest guys you'll ever meet, so it was really too bad. Not a doctor, but work at a pharmacy. Once heard the story of a woman who came and asked the pharmacist what she should ask the doctor to prescribe for a different kind of birth control, as she was having a hard time swallowing the one that she was on. So the pharmacist looks up what she was taking, only to find out that this woman had been swallowing her NuvaRing. Happened when I was an intern. Guy came in for some random complaint, got admitted for sepsis. Saw him in his room, which had an oddly pleasant odor. Kinda odd, but didn't think much of it. Started to examine him and saw lots of bandage on his lower leg. Asked him why, and the dude said he had a wound and he wrapped it himself. So I started to take off the bandage and started to see blue. I was like, WTF? More and more blue bandage, and even his skin ulcer was blue. So, turns out he thought since he would use Windex and Lysol etc. to clean tubs and drains, that would also be a great idea on his wound. Took a great while to convince him to stop. Not entirely sure I succeeded. This happened in a rural area, and this was at the indigent hospital. A man came in who had been chopping wood. The axe slipped, hitting his leg. He poured gasoline over it to try to disinfect it and stop the bleeding. Then he lit a cigarette. We were treating him for a very badly infected leg, which was also severely burned. Also, there is a saying in rural areas that it hurts so bad I could have shot it off. A woman came in who had sprained her ankle. She couldn't take the pain, so we ended up treating her for a self-inflicted gunshot wound to the foot. I'm not a physician, but I am a healthcare professional. I once had a chest pain patient who came into the nuclear medicine department for a typical MPI, and he had a very pungent, disgusting smell to him. I work/go to school at a university medical center, so we serve the locals and indigent patients mostly. Finally, I get him to acknowledge the smell, and he says his toe has been feeling funny. Turns out he cut it or something, and an infection engulfed that toe and began eating part of his foot. It seriously might have been gangrene. I immediately called our nurse, who notified about 3 different physicians who took samples and immediately rushed him out of our department. Please consider subscribing if you enjoyed. Love.